Hello, everyone. Welcome back to the 2019 Brain Health Online Summit. I am Amy Zelmer from Faces of TBI, and I fell on the ice in February of 2014 and suffered a traumatic brain injury. And myself, along with Dr. Jeremy Schmo from Midwest Functional Neurology Center, we saw a need in the brain injury community for more training and education on alternative healthcare methods and modalities for those still suffering from the lingering effects of a brain injury. So each day during the summit, you are going to hear from a presenter who will share either their real life experience of living with a brain injury or their experience working with brain injury patients. And today I am here with Dr. Molly Parker. And Molly is a physical therapist and concussion survivor who is known for utilizing her unique background to create Molly Parker PT, an online resource for all things concussion. After an 8-year recovery, Dr. Parker knows firsthand the devastating effects poor concussion management can have. Her commitment and passion to empower those involved in concussion recovery is changing the trajectory of concussion management. So welcome to the summit, Molly. I'm so happy to have you here.
Yeah, thanks for having me.
So maybe why don't we just start with you giving us a little background on your concussion injury?
So my concussion it'll be 8 years on February 11th. So by the time this year airs, I'll be 8 years out. And I was on a crowded street corner with a group of friends, and a cab driver fell asleep at the wheel and went into the crowd. And so me and several other people, and I had that initial, I impacted on the windshield, someone impacted on top of me. I got off the hood of the car and I had the immediate, headache, goose egg. And I remember thinking that I was really fortunate. There were people in the accident who were hurt significantly worse than I was. I went to the emergency room, they cleared me. And I remember feeling like I walked away and feeling really lucky and really having no idea what a concussion could turn into. So fairly quickly, I started to have very severe headaches. Those headaches got worse. I had a lot of just feeling really off, feeling out of it, some memory problems, dizziness, nausea, started to kind of experience really the whole gamut. And it ended up in this almost probably 2 years of going from doctor to doctor, deteriorating rapidly, and people really not knowing what to do, not having any awareness of concussion whatsoever. So it wasn't so much that people were acknowledging it and didn't know how to help. It wasn't really acknowledged at all. So I ended up, losing my job, had to go home, coming back to work a little bit too early because I was so stressed financially, and I was feeling a little bit judged, and continued to backslide. And at about 3 years, I was the worst I had been. I had severe visual, vestibular headaches, nausea 24/7. Severe headaches 24/7. I barely slept. Memory issues, speech issues, personality changes, autonomic dysfunction, and it just snowballed. And so what has ended up happening now is I've spent the last 4 years digging myself out, so to speak, and trying to find healthcare providers who treated my symptoms. I've made a significant amount of progress. I'm expected to, hopefully, fingers crossed, potentially recover this year. We're kind of down to the last couple things that we think are affecting things. But it's just been a journey. And it's, I tell people I'm not the example of someone who was really bad right out of the gate. I'm an example of poor concussion management and the devastating effects that can have. Yeah, that's kind of where I'm at now.
So when you had your injury, you were already a PT.
Yeah, so I was working as a physical therapist, and ironically, we treated the difficult cases in town. So we had the chronic pain, we had a lot of sensitive nervous systems, we had a lot of autoimmunes. And so I learned collaborative care in that clinic right out of school, because when you're treating particularly autoimmune patients, you have to be aware of what you treat, but also what the surrounding professions do, and be a screen to see if someone, perhaps needs to see rheumatology, or perhaps, needs to get X, Y, and Z checked out. And so when I moved into then being my complex case and going to see healthcare providers, the understanding of collaborative care just wasn't there. And so it was really frustrating to have to manage my own care with a brain injury when I had, I had a drop in IQ, I had no cognitive flexibility, I could barely put on my pants, and yet you're having to manage this like complex injury. And so it was just very frustrating, and that's kind of what this talk for me.
Yeah, and it sounds similar to me. I mean, right away, I knew I wasn't okay. I mean, I had dizziness, my head hurt. I mean, my head was just pounding. I knew I wasn't okay, but it was over those next like 14 months, the things just really compounded. Like I didn't have the 24/7 dizziness until probably like 8 months in. And it was like, what's happening? And doctors are telling you, oh, this can't be from the concussion. I think it's just anxiety. I think you're just depressed. And that does it lead, like you said, poorly managed concussions. I think a large majority of people listening are going to relate to that. And just those symptoms your symptoms don't have to be there right away. They can take days, weeks, months to, start to develop. And if it's a snowball, you're not treating this one, and now it's snowballing. And it takes finding that right doctor or the team of doctors to really help.
Yeah, definitely. And then you have all these people who, brain injuries they're very challenging physically and mentally, and they affect your life in every way. And then we have these people trying to get help, and they're spending all this energy that they just don't have on trying to defend themselves and trying to defend themselves and trying to convince the doctor that there's something wrong in the first place. And it's just coming from someone who had a chronic pain background, where we know those things contribute to symptoms. It was just really frustrating to watch myself caught in this trap that I was aware of, but that I couldn't get myself out of. It was a different look at things for sure.
So what was the point? When did you finally, you said it was like about 3 years in, what was that moment? Like what finally connected for you in your care?
Wasn't really. So I got progressively worse, and about 3 years is when I went from bad to worse, where it was like, it felt like Jenga, and like that bottom piece got pulled out and everything just kind of collapsed. And I met around that time, I was financially very poorly off and very stressed with that sort of thing. And I reached out to a gal and basically said, look, here's what I'm dealing with. Here's my background. I'm very motivated to get better. I'm really struggling financially. Here's all I have. Can you help me? And I haven't talked about that in a while. Like little emotion. But so she was kind of my grace. So she was the first one that really kind of acknowledged the symptoms. She was the first one that had any sort of background knowledge at all. She was the first one that connected with other healthcare providers in the community. I'd had a neuropsych evaluation like 2 years in that had been sent to my doctor, not to myself, that basically said I had, vision problems, and nobody told me about them. They sent me to a psychologist. So I found out from this woman, 3 years in, starting to work together, that there were vision issues. And I don't think I made it to an actual vision therapist till I was 4 years in. And I had these symptoms that had been identified like years before.
Isn't that crazy? I mean,
so I came home, and then having the family support, and then having, then finding care with the help of this gal was what turned it around for me.
And I think that's what's so frustrating for so many of us is, it's years down the road when you find something out, like vision. Like, how was that not caught early? Like, it seems like a simple thing that should have been caught early on. And I think that's what's so frustrating is, we've been brought up to go, to your general physician, right? And then from there, you go maybe to the neurologist, the neuropsychologist, and nowhere in this continuum do we ever get referred to any sort of alternative, like even vision therapy, right? Like we just don't get referred out to any alternative therapies. And that's where the key is at.
Yes, definitely.
So what were some of the therapies that helped you? You started mentioning vision therapy, but what are some that you found?
I found several. It kind of, for me, it wasn't really one thing. It definitely took a village. It was, I just started with neurofeedback and vision therapy. The neurofeedback guy in town is just phenomenal. And he was really great at not only explaining and validating my symptoms and giving me some treatment options, but also helping my family to understand. So that's kind of where it started. I plugged away with that. I plugged away with some vestibular therapy. And then about 5 years in, I ended up in Utah at Cognitive FX, where I had a significant improvement in my speech and in personality changes, but left with, I'd had this left-sided weakness that, like you, didn't start till I was like 9 months in. And it'd gotten significantly worse, and it gotten to the point where if I wasn't holding my body rigid, I was shaking, where it looked like looked cerebral palsy, kind of stroke-esque. And so I left there with that feeling a little bit worse. And so then it kind of came to the point where, I've had these vision and vestibular in my neck and I've treated them, but there's clearly a movement disorder component here that we need to get addressed. So then that brought me to probably another year before I'm someone who could treat that, because I'm learning that movement disorders with concussion, much like other symptoms, don't present quite like typical cases. It's like dystonia-ish, it's dyskinetic-ish. And so it was very challenging to find someone who could marry both those things together. So it took me about a year before I ended up at UCLA. We made significant progress. I had a very, very involved sensory motor disorder. And about this time last year, went there expecting to be all finished up. And then we had a really difficult time getting my eyes and my jaw and my neck to stop shaking. So I ended up with functional neurology, which has been really helpful. I just did an intensive week about 2 weeks ago, and we think we've kind of nailed down the last of it. So it's getting the last bit of the movement disorder out of my jaw. Then we'll go back and retrain the pathways that are moving through that area of the brain that's having a hard time stabilizing. And theoretically, then I would be done. So it's been several people away. It's definitely not been a one or two things for me. It's been a combination.
And with me, with functional neurology, during my week-long intensive, like I definitely had significant strides just in that week. Not everyone has like really profound breakthroughs like I did. But then the key for me was those 6 to 8 months afterwards, doing my exercises at home. And it was gradual, but all of a sudden, like maybe 9 months later, I was like, oh, hey, I don't have this or this going on anymore. Like they just kind of like you fix that one main thing that's, holding everybody up. And then they all start, it's sort of like dominoes, they kind of fall into place. So.
Yeah. It felt like I was undoing all the secondary problems. And now I feel like we're getting back to kind of the initial stuff. But yeah, it's interesting.
And we've talked a lot in the summit just about a functional approach and how, because I get asked a lot, what does functional mean? What's functional neurology? And, the functional component of it means that they're looking at your whole system, not just one thing. They're looking at how are your eyes working? How is your vestibular system working? Like you had some movement disorder. I had some gait problems. I had a lot of neck problems. It's looking at all of it, not just one part of it.
Exactly. I think when you become a practitioner, whether it's in functional neurology or whatever, if you can understand your piece, where you really thrive, but the big picture with who else needs to be involved, how does my treatment fit in with theirs? I think those are the people that really become the game changers. And those are the people that once a patient finds them, really changes the trajectory of their recovery. And I think right now we still are a little bit isolated, not only with surrounding professions, but even for physical therapy, for example, within our own. So we have, like medical school, we do, different rotations in different areas. So we have people that do orthopedics, which is just, like neck and back. And then we have people who do just vestibular. And then we have people that do just neuro. And concussion is all of those things. So if it's something that really want to be a game changer for your community, it's learning how to integrate all those three things together, because they're so interconnected that you have to be able to address them as a group to be as successful in your treatments as you'd like to be.
And I think, fortunate or unfortunately, the majority of people end up at the neurologist. I did. That was one of the first places I was sent. And, they do an MRI, nothing shows up. Yay. I don't have something worse. But then, they don't do anything else for you. I was told, just give it more time, give it more time, give it more time. And, I just think we need to somehow bridge that gap. How do we get that neurologist to understand all of these other people are out here that can help and say, hey, here's, this group.
Mm-hmm. Yeah, agreed 100%.
And I just, that's the $1 million question, right? But that's why we're doing summits and helping people realize, the neurologist probably isn't going to help you for a concussion. And, there's other modalities, so as a physical therapist yourself, and you're going through this, and like you, at some level, I'm sure you had some education on concussion, and, not really,
which is crazy. I was a pretty new graduate, and we went heavily into severe TBI. We months and months on it. I don't remember any concussion at all. And then my sister at the time had just finished her residency she's an emergency medical physician. And so it was like we both got the pieces where we both understood headaches, and we both understood neck, and we both understood kind of the parts of it, but we weren't taught how to put it together or what a concussion really means or how it affects someone's daily life. So I learned most of this through my own injury. I didn't know what post-concussion syndrome was at all. I had my accident, which is,
Yeah, a good friend of mine, she's an RN, and, she's like, I knew nothing. She's like, we get maybe a chapter on it in school, in nursing school. She's like, but I've learned so much through you. And, just by watching my journey, it's helped her with her patients. And Dr. Samadani, she was on last year's summit. She's a neurosurgeon, and she learned nothing about it until the neurosurgeon part of the curriculum. She's like, it's fascinating how it's so glazed over in school.
I think they're putting it, I ended up going back to the program I went to and taught a foundational course for them. So it was kind of, a lot of the things we were talking about today. It was understanding concussion, understanding what it is, understanding there's different types, kind of giving them the understanding of each trajectory, the symptoms, who treats them, where they fit in. We went through stories of every symptom based on my day-to-day life. And I think especially in the beginning, there wasn't an awareness really at all. So it was getting people to understand the story first. And then as public awareness started, people started to come to the lecture ready to learn, having questions they already had in mind. And the cool thing is people would come up after and they'd be like, I have my sister, husband, whatever. Yeah. And they'd say, they're struggling with something. I don't really know what's going on, but you're saying the same things. Like the story you're telling, that's what they tell me. And so I think that was step one of just getting people to hear the story and then understanding, their role, everyone else's role, and how to kind of put it all together. But my program just put in a post-concussive unit within the last year. So it's still a lot of healthcare practitioners aren't getting this.
I do a lot of speaking at conferences, but they're brain injury specific conferences, right? So I'm speaking to a group of people who want to be there to learn. I really want to get into other broader conferences, RN conference or PT or whatever it might be, and getting in front of people who, I hadn't even thought of that, or, that's where that bridging that gap is going to happen, I think.
Yes. I think building that curiosity to learn more is kind of that first step, because for a lot of people, there wasn't the awareness at all. And now I think that shifted a little bit. Now I think people are aware that there's more to them and they're open to learning, but they don't have the information. So I think it's a really unique time in history to make a lot of changes, hopefully quickly.
I agree. And, I think someone like you, when you do get back to working, you're going to be such a better PT having gone through this experience, as unfortunate as, an 8-year recovery is, it's going to make you such a better doctor.
Yeah. I'm hoping to specialize specifically in concussion when I go back, but I will probably rework. This injury has taught me so much. I'm going to rework my lifestyle a little bit different than I had it before, but I will definitely get back into the clinic in some capacity.
Yeah. So what other, are there any other thoughts of wisdom you have if there's practitioners listening? I know we have a lot of practitioners that take part of the summit. So any wisdom for them?
I think for healthcare providers, it's step one is just understanding that, just like knee and back injuries, there's not just one type. So it's understanding, getting familiar with trajectories. So there's, the 6 trajectories, 7th being suggest. So there's cognitive, you have ocular motor, you have vestibular, you have mood, cervical, headache. And then cardiovascular is being kind of the new one proposed. I would argue that there's also going to be a sensory motor trajectory at some point. So it's understanding the different trajectories, that they are typically coming in combination, and then being able to take that person, particularly the folks with a persistent case, and be able to do a thorough evaluation for what do you do, kind of what's in your lane, where can you be of service, but then being able to screen for all the other healthcare professions involved. So for example, so if you're a physical therapist and you have someone coming in, but they're also having, difficulty reading and they're having difficulty driving, that might be in light sensitivity, that might be a neurodevelopmental interest. If having someone with memory issues, attention issues, sending them to speech therapy. If you're having someone who is, heavy in the mood anxiety category, is there a blood flow issue where you can contribute, but also a cognitive behavioral therapy aspect that they can be on? So it's really understanding that whole big picture. And I think that's what takes a healthcare provider from being someone who's kind of helpful and from having the patient say, they were really nice and it helped kind of, to this person was what turned it around for me. It's having that big picture perspective and then really understanding what that means in their day-to-day life. I don't think a lot of people understand that very well. And then it's learning how to put together a program. So for example, say you have someone with, a whole mess of symptoms. It's learning who else needs to be involved, where do we start, and then having an idea of how to order things. So for like a physical therapist, for example, say you have someone who has a significant loss of proprioception in their neck. They think their head is here, and they also have visual issues. It's going to be helpful if you treat that neck first and then send them to vision therapy. That way, when they're going to vision therapy, which is typically expensive from a patient's perspective, that they're in the best state possible to really succeed with that. With that health care. So it's really understanding, how do I put this all together in a meaningful way so that this person's successful and that they're not spending a lot of time back and forth. I think when we don't have that, people get really scattered, where they're trying their neck is getting treated for a month or two here and it kind of helps, but not really. And then later they're doing vision therapy, and then later they're doing something else. And it's really, their friends recommending it, their neighbors recommending it, and they're just trying all these random treatments. And it's really understanding how to put them all together. I kind of use the example of, if we're trying to say, how can a human being best function, and we're trying to decide if it's food, water, or sleep, you can't do one at a time. It's those things together that really make the change. And so I think for healthcare providers, that is a foundation. I think that should be a first step. That should be in every foundational course. And that should be something that we all build off of. Yeah, and then for patients, understanding that too, so they can, their own care while everyone else is catching up and, you know, yeah.
Mm-hmm. You know, and it's challenging because when you are a newly brain injured person, you know, I know for me, it didn't even occur to me to Google things.
Yeah.
Like it just didn't even occur to look things up.
Yeah.
And I mean, it's such a like a duh. Why didn't I look that up? You know, but your brain isn't working right. And I couldn't do much
Well,
screen
even
time.
when I looked it up, oh yeah, that's a big one.
Mm-hmm. Scrolling was just like, that would just instantly make me dizzy. And if I did read it, I wouldn't know what it meant anyway. So, you know.
Yeah, it's really and then when I was first injured, I would Google it and it would say that it was psychological.
Yeah.
So it was very, very frustrating for sure.
Mm-hmm. Yep. I have a Facebook group of almost 10,000 members, and I would bet you about half of them are on antidepressants and that's what the neuropsychologist wanted to do to me. I think you're just depressed. And I was like, no, I'm depressed because like I can't live my life. I'm not like the depression didn't come first. Like, yeah.
Exactly. Yeah, I was fortunate and I escaped a lot of the depression for the first probably 2 or 3 years before I had a big episode. But people were saying that to me and I was saying, I love my life. I love my job. I have a million activities I enjoy. I'm excited to get back to them. This is not depression. I can't physically do it. And it was like people just hear it. And it was just, which added on, I think that added a lot of, I don't know how to put it. I think it made my recovery a little bit worse. All the extra emotional turmoil and spending all the energy having to convince people rather than having to be able to put that into my recovery was really very frustrating.
Yeah. 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 I know. I lost a lot of friends really early on, surprisingly. Yeah. Like it's just a concussion. It's been 3 weeks. Like seriously, why are you still complaining about this? And I'm like, if you could just come observe me for one day, you would understand.
I had initial loss of friends and I had a group kind of in the middle of my recovery when it went from bad to worse and I started putting up more boundaries. I had like 2 big purges. Now I'm left with a small group of people that are all love me.
Yeah. Well, Molly, this has just been such a great conversation, and I think that this will be really helpful for people listening, you know, especially those who haven't quite found, you know, outside of their general doctor yet. So, you know, I just think, you know, my goal with these summits is hoping that people find this stuff earlier in their recovery and that it can help them find the right providers. But I also want to reiterate that no matter where you are in recovery, you can be 5, 10, 20 years out, and there's always hope.
Oh yeah. All my recovery came after like 4 to 5 years, and it's picked up pace. So it's entirely possible.
Well, thank you, Molly. And I know you're very active on Instagram as Molly Parker PT. So I appreciate all that you're doing on there to try and help educate everyone.
Yeah.
So
thank you for this.
And thank you so much for being here, Molly. I really appreciate you taking the time and sharing with our audience. And thank you, everyone, for watching. And we'll see you all in the next episode.